We are now going live again. Let's see if I can get this to work. All right, we're streaming live on Facebook. So let me start by just thanking everybody for joining us. And good morning, good afternoon, wherever you are. And just a little background is this webinar is being sponsored by the Phoenicia Foundation. And our mission is really dedicated to helping special needs children and their families blossom. We want to help all children realize their potential, give their family support, and increase caregiver, educators to make a positive difference in all children's lives. So with that, we have Vanessa here to talk to us about sexuality and how to talk to our children about that. And so I want to thank you, Van, for preparing this for us this afternoon, I would say morning where you are, and this evening here on the East Coast, but wherever you are in the world, we're just glad that you have tuned in. And again, we're on Facebook Live. We will, copy this and put this onto YouTube after the webinar. And if anybody who has questions, if you could please put those in the chat, we would greatly, greatly appreciate it, either on Facebook, in the comments section, and or messenger us on the Phoenicia Messenger. We'll be watching for that in the either messages or the comments, and then also along the side here in the Q&A section. So with that, I will let Vanessa, I'll let you start, and I'm going to go on mute, and I'll connect at the end of the webinar for Q&A.
Okay. Good morning, everybody. From where I am in the Philippines, it's good morning, and wherever you are in the world, good evening, good afternoon. I hope you are doing well, healthy, and safe as always. Okay, I'm honored to present this topic to you. This is something that is close to my heart, as I've noticed that a lot of parents or even professionals are not really comfortable with this topic. So I'd like to hopefully share to you a thing or two, and maybe you can pick up something as you connect, as you teach your children. Okay, so let me share my slides. Okay. So talking about sexual behaviors to your child with special needs. Okay, each person's understanding and definition of an experience with sexuality is unique and will evolve as one moves through different ages throughout life. Often, sexuality is defined as the way a person experiences themselves as a sexual being. So it is essential to know that the definition of sexuality is complex and unique for each person, and it involves a lot more than just the sexual activity. For some, it will never involve sexual activity. A person's personal definition of sexuality includes our gender identity and orientation, feelings of attraction, the ways we choose to be intimate with others, our personal body image, our values in terms of personal, family, cultural, spiritual, and societal, and how this influences our behaviors. You may be asking, well, that's me as a parent or as a teacher, as a therapist, or as a sibling. But what about my child or my sibling or my godchild with special needs? Okay. So for this presentation, we are going to emphasize on the following. Okay, first is I'd like to introduce to you the sexual development and common sexual behaviors seen in children. So hopefully we can identify teachable moments about sexuality, teaching body safety in children, red flags in a child's sexual behaviors, and addressing problems related to sexual behaviors. Okay. We will start with familiarizing ourselves of the progression of sexual development, identifying what are typically or normally seen at a certain age. This is not to dismiss as seemingly odd behavior, but first we have to understand that there are certain behaviors that are normal. A child should go through that stage. Hopefully you will understand why it is happening and when to be worried. We have to be familiar on what is typical so that we can identify what is different. So we will present the behaviors or milestones by age group. These are not definite, but it's easier to present it in these 3 stages. This is not also rigid. The important thing is that you are familiar with the developmental progression, which comes first, which comes next. Okay, I will not go beyond these age groups. If your child is older than the mentioned ages, don't go yet. You may find the information here useful for you to understand your adolescent's behavior. And if you have younger children, it may also be helpful. This can also be helpful even if your child doesn't have special needs. If you don't have a child with special needs, the talking points here can also be useful to children without special needs, because I believe that the contents to teach children should be the same as the children with special needs. It's just that the methods of how to teach them can change. Okay, so let's start with preschool children. So this is around less than 4 years old. Okay, at this stage, they explore and touch their private parts, either in public or private. So if you have children this age or you've seen children this age doing this, it's actually normal. Rubbing parts with their hands or against objects. Some of the children would rub their private parts against the table, against a chair. Okay, showing private parts to others. Trying to touch or other women's breasts. Okay, I have seen varied reactions of adults about touching breasts. Some would react screaming or angry, or would react or would correct the child by shaming the child. So some of the children are doing this, although some of the children are doing this to request for milk. Well, if that is the reason, it is up to the parent when to stop breastfeeding. Or you can explore other ways of communicating to you that your child wants milk instead of touching. Okay, like use of picture cards if the child has limited expressive language, or just teach him how to say milk instead of touching your breast. Because at this point, we have to start teaching them appropriate and inappropriate touches. So that includes touching your breast, even if they want milk. If the child is curious about the breast, or maybe not requesting for milk, that is normal at this stage, but maybe you can start correcting them by teaching appropriate versus appropriate touch to certain body parts, or just use their eyes. Using a matter-of-fact tone of voice, that means without using an angry tone or shaming tone to a child. Like here in the Philippines, we have a common gesture of reminding the child at the same time, shaming the child, like it's saying, halaka, lagot ka. So if it's translated in English, it could be something like, oh no, you're in trouble. So that is like shaming the child. That doesn't help because you're not really correcting the behavior, or what should they do instead of doing that kind of gesture. Okay. So preschool children have spontaneous reflexive responses like erection and vaginal lubrication. So sometimes when you change diaper, it will erect, and then some caregivers would react screaming, oh, so that's normal. Don't react to it, please. At this stage, there is already gender awareness and identity that develops. So the child knows boys, girls. If your child doesn't know yet at this stage because of delays in language, maybe you can start teaching that already. Focus on that instead of, like teaching them the letters of the alphabet or prioritizing the letters of the alphabet. Also, at this stage, they should be already aware of the role conditioning, like boys and girls are treated differently in some cultures. And then boys and girls have different expectations. So these expectations or assigned gender roles what is masculine, what is feminine is culturally derived. So you have to be aware with your cultural background. And of course, if you have a different cultural background and you are an immigrant to somewhere, so you have to be aware also where you are. Okay, so you decide on that, how boys should behave, how girls should behave. However, you should be aware that the outside of your home and outside your family, there could be differences. So you have to be aware of that and teach them. Okay. Example of gender roles, like parents' bias are often seen in toys that we buy for them. So it's usually assigned by gender. But now I appreciate it that many parents are more open, as many are allowing their boys to play with kitchen set and girls with toy guns and cars. So just a little segue. If you are a parent who is rigid on putting gender bias on toys, as an OT, please reconsider, as the child imitates the adults in their daily life through play. And this is the first step for children to understand their environment and what is around them. So if you limit it, maybe you are also limiting the experiences for learning. So example, cooking. You can observe a lot of skills in cooking play, and at the same time the child learns a lot from it. So I have met fathers who are not comfortable when their boys are engaged in pretend cooking. So please allow boys to play with cooking set. There's nothing wrong with it. Okay, so going back, at this stage, they explore their own bodies, hands, feet, tummy, genitals included. So they may also enjoy nudity. So curiosity about differences between bodies. So they compare body parts. So while they compare, of course, they will try to touch it and touch their own private parts. So curiosity about siblings and or parents' body. So when they are curious, they watch you undress. They would like to see you while you're taking a bath. Some boys might push up your skirt and look at your underwear or your visitor's underwear. So which can be very embarrassing to many parents. But it is a normal behavior because they are curious. Now, use that time to correct them, but please do not, as I said, use a matter-of-fact tone and avoid being angry and avoid shaming. Okay. And then toilet training starts for some, but usually, especially if you have kids with special needs, this will come in a little bit later. But usually at this stage, it is expected that they begin to master the skills. As an OT, I commonly see parents that want their child to be prepared for school, but be able to sit, but toilet training goal is often left out. So as for me, I would like to encourage parents to start with toilet training ASAP, okay, as soon as possible before even thinking about putting them in school. So please prioritize toilet training. My stand here is that the child should be able to clean their private parts, like touch their private parts for cleaning as early as they can. So if we can train them as early as possible so that they will not be comfortable other people touching their private parts or dependent on others doing it. As many sexual perpetrators are familiar to the child. It could be a family friend, a hired caregiver, or even a blood relative. So we can't depend on others doing it for them. So if you are pampering your child too much, you will not protect them from these predators by not training them life skills. So please remember that. Okay. So what to teach in preschool as basic information? So after knowing what kind of development they go through, what skills they have, what to expect in children at that age, here are some points to teach. You can start with basic information and then body safety information. For basic information, boys and girls are different, like common features including body parts and what they wear. Accurate names of body parts. Go ahead and call it vagina. Go ahead and call it penis. Not flower, not cookies, not birds, not bees. Okay, why is it important? Here is a personal experience. My sister-in-law is a policewoman who was assigned at the woman's desk in Makati. So she deals with rape, domestic violence, domestic abuse. Usually that's the cases she handles. When she's on duty at night, and from time to time she brings me along so she has someone to talk to, I've seen a 3-year-old girl narrating how her uncle put his fingers on her vagina, and she called her vagina flower. So when her statement is translated into a written form, of course it is verbatim. When the policewoman takes statement, it's verbatim. So there has to be someone that should say in the statement that the flower is indeed the vagina. So it's more accurate for them to narrate it if they know the name. Another story, although this is not firsthand, a teacher told me about this. A vagina is called a cookie instead. So the child has been telling the teacher that her uncle ate her cookie and it is his favorite. The child kept on repeating it many times. And come family conference, the teacher told the parents that their daughter has been repeating this sentence over and over. Then the parents were distressed and as they named the vagina cookie. So it is important to use the proper name. So then if they ask, usually at this time they ask, but where do babies come from? So you can just say babies come from mommies. You don't need to say that there is an act to have babies. So they're too young for it. Okay, so then very important rules about personal boundaries. Private parts should be covered, not touching other children's body parts. So they are curious, of course they will do it, but you have to emphasize that they shouldn't do it. Okay, teaching them what should be done in private, like changing clothes. Sometimes parents, especially when in a hurry, we change their clothes in an open area to save time. So please teach them as early as now that changing clothes is done in the restroom, or in the bedroom, and not on the living room or any common or public spaces with other people around. So you have to teach them. Sometimes it's easy to dismiss, oh, there's no malice yet, they're very young. No, you have to teach them now, okay, where to do these private activities. Okay. You also have to identify private spots at home. Like when mom goes to the restroom, her little boy shouldn't go with mom. Okay. So you have to practice that. Okay, teach them how to close the door for privacy when they pee. For me as a professional, we are teaching children this. It is included in activities of daily living. So it is hard in the clinic. Like I am worried if the child I'm handling might slip, might get into an accident. So to balance supervision for safety and teaching them also privacy, I teach them to close the door when they enter the restroom. And I will just hold the door with a small opening so I can peek from time to time to check if they don't hit their head in the bowl or whatever. So I also show them that I turn my back, step aside or step back or go out when they are in position to pee. So of course, for very young children or they have lack of skills, I have to assist them. As soon as they have more independence in sitting the bowl, they don't fall from it. I also tell them, I will wait here outside until you're finished. So you tell me if you're finished so I can help you, or you ask teacher if you want help. Okay. So also boundaries about pulling and pushing other children. They do it with play. Like when they want to play with other children, they have the tendency, oh look, let's go, let's play. Then they pull the child's hand. So as early as possible, pulling another child's hand to invite them to play without their permission is a no-no. Okay, especially in group sessions, like in the center before COVID, so we have group session. It's always teaching them to offer their hand out to invite while the other child is assisted to get the hand or to touch the hand if he or she agrees to the hand, to the invitation. So if the child refuses to hold hands, we don't force them. But of course, we explain to them why holding hands, like in circle time, is important. But if the child still refuses, or they still refuse after to verbal prompts, we don't force it. Why? As other children who are in the group may be more aware, they have higher language skills, they have higher expressive and receptive language. It is important to model to them that it's not okay to force someone or force someone to touch. Okay, so you don't force it. So of course we don't want to model this inappropriate behavior to other children. So in summary, in personal boundaries, emphasize on private activities and spaces versus public activities and spaces. Not okay touch, comfortable touch versus uncomfortable touch, allowable versus not allowable touch, like where to touch in their bodies and other bodies. So like when you greet an elder with a bow. For some cultures, they bow to the elders, or by putting their hand on the child's forehead, putting their hand on the child, and then putting the elder's hand on their forehead. So the child does that. So in the Philippines, we call it bless. So instead of kissing and hugging. So we can teach our children how to be polite and warm to adults, to other adults, like your friends, family members, without kissing and hugging. So can you reflect? Are you the type of parent that summons your child to kiss or hug auntie or uncle to greet them? Okay, here in the Philippines, we have this like bless uncle, bless auntie, and then it's like the elder's hand is held and touched on the child's forehead. So as a sign of respect, slowly it is being replaced with kiss uncle and kiss auntie. You don't usually see bless anymore. So as for me, you have to rethink, you have to reflect, does this send or does this teach your child body boundaries if you force them to kiss and hug, even family members, even grandpa and grandma? Okay, so lastly, give simple answers to questions about the body and body functions, like naming parts and tell them what is it for. So if they ask about the penis, okay, what is it for? So it's for passing water. Next is how to teach body safety information. Okay, so in preschool, what's appropriate? Again, okay versus not okay touch. Okay touching, you have to teach them that it is something comforting, pleasant, welcome, and at a certain body boundary. So meaning the vagina, the penis, the breast, the butts are off limits. Usually what I teach the children, from the shoulder down to the buttocks and down to the penis, not allowed to touch. Don't let anybody else touch that except mommy, daddy, or if it's teacher, always ask permission. So if you are a teacher, always ask permission. Even if you're a parent, always ask permission. You tell them, I will touch your vagina to help you wash or something like that. Okay. And touching to get attention, some kids would like touch because they cannot call out their names, or they act faster than thinking or retrieving what to say. So they tend to touch. Okay, so you can teach them how to use light touch, tapping on the hand, maybe up to the shoulder, but beyond, like down the shoulder, no. Like they shouldn't touch the any part, like from the breast down to the tummy. So always teach them, if they cannot call out people's name, they can touch the hand only. So teach them that the hand is it's like an accessible way of communicating or calling attention, but not other body parts. Okay. So not okay touches are intrusive, uncomfortable, unwanted, and painful. So you can also teach them that their body belongs to them. So your body belongs to you. So everyone has the right to say no, even to grown-ups. So no one has the right to touch your body parts. Again, teach them as early as now how to wash themselves. Letters can wait. Let us focus on life skills. Okay, it is okay to say no to grown-ups when they are asked to do things that are wrong. So what is wrong? Remember the personal boundaries in the basic information in the earlier slide. Okay, you should teach those basic information and teach personal boundaries. So if someone asks them to touch beyond that boundaries, that is considered wrong. Okay. So remember these parts over here. So over here, the breast, down the vagina, and the penis of the boys, and the butts off limits. Touch only the hand, okay, which is the most distal part of the body. Okay. Also teaching them surprise versus secret. Okay. There is a difference between surprise, which is something that will be revealed soon, like a present or a surprise party, and a secret, which is something you're never supposed to tell. So emphasize that it is never okay to keep secrets from mommy and daddy, or grandpa or grandma if the parents are not there to take care of them. So let us reconsider using the term secrets. Sometimes, parents, when your child asks questions and you answer them secret, just to dismiss them. And you can think of ways to answer them because, the preschool, they ask a lot of questions. Even if they have special needs, they are so curious, so they keep on asking. And then sometimes to just dismiss them, we call that you just say secret. So don't say that, please. Okay, so try to come up with other answers, or you can just, if you don't have the energy, you can just, I'll talk about it later. Maybe you have other problems or other things that you're thinking about, and then your preschool is just, just up to your face and asking you these questions. Please don't use secret, because they have to remember, or they have to understand that secret, there's no secret between mommy and daddy. Okay. Remember, a preschool is curious, so even if they have delays, special needs, you will see this curiosity. Okay. Next, very important, who to tell. If another person do not okay things to you, or ask you to do, not to do things to them, who to go to? Is it to mom? Is it to dad? Is it to the police? Okay. Who else? Who are the trusted adults at home? So you have to train them who to tell, whatever it is. Okay. Okay. You can present them in pictures like this. Okay. So you can, especially if you have a child with special needs and they're still developing their language skills. So you can present them in pictures. You can do role playing, like you teach them how to say no in role playing when being touched inappropriately. You can visually present them in pictures like this one, or videos, and just do role play. And role playing is still effective in teaching children concepts who need support. So when I say need support, it could be a child with a variety of diagnosis or disabilities. So if you have a therapist, you can ask your therapist to help you. If your child has a special education teacher, you can ask them to help you. But if you don't have anybody, just come up with this kinds of pictures, what you want them to teaching them no. Okay, maybe you can change that X to a sad face, or maybe to an angry face, whichever works for your child. Okay. Now let's move on to young children. So this is around 4 to 6 years old. Okay, some up to 7. It depends on your reference, but as for our discussion, let's just put it around 4 to 6 years old. So usually they purposely touch private parts, occasionally in the presence of others, or sometimes by them alone, privately. Okay, attempting to see other people when they are naked or undressing. So mimicking dating behavior such as kissing, holding hands, talking about private parts, and using naughty words, even when they don't really understand what they mean. Okay, exploring private parts with other children. So like playing doctor, I'll show you mine if you show me yours. Okay, so at this time, childhood sexual play is a bit evident, or you can see it. So in young children, when you say childhood sexual play, play doctor, or I'll show you mine. Okay, at this stage, they are curious not only about their own bodies, but about others too. So if you find your child or young child playing doctor with another child around the same age, it is important not to overact. To them, it's just innocent game. Of course, if an older child or an adult is involved, your concern would be legitimate. Okay. So calmly ask your child to get dressed and distract him or her with a toy or game. And then you might want to take that as a clue that your child is curious about the human body and facilitate learning. So you can actually try teaching them the body parts and what is it for, and then about privacy and consent and private behaviors. Again, maybe you taught them already previously when they were younger. Maybe you have to teach them again, remind them. Okay, so at this time, they learn more about gender role. So more information how to behave like a boy or like a girl. You can also hear them playing boyfriend and girlfriend. So some parents of preschoolers or young children are alarmed when they hear their kids talk about a boyfriend or a girlfriend at school. So if your child says this, remember that kids don't attach the same meanings to the word that adults do. So most experts agree that it is best to react to this kind of news in a neutral way. So don't encourage the behavior, but don't express concern either. So, or you want to clarify what they mean. So they also start to learn sex words or bathroom vocabulary. Okay, and they can also ask questions about pregnancy and birth, like how babies are made, how our babies are born. So they also begin to distinguish acceptable and unacceptable behaviors. You can teach them the do's and the don'ts, the no, and the yes. Okay, possibility of masturbation, don't be shocked. Okay, self-stimulation, okay, however you call it. Okay, and then some of them may start to become more modest about their own body. So they start to know which parts to cover and they have their choices of clothes. Also consider that the media, okay, whatever media it is, okay, influences understanding about gender through societal and family roles. Okay, so it's really important to watch or to check what they are watching in YouTube and in whatever platforms they are in. Okay, so what to teach in young children? Okay, so boys and girls' bodies change when they grow older. So simple explanations on how babies grow in the womb and the birth process. So also, very important, strengthen the rules about personal boundaries and privacy. Okay, so where to change clothes, again, close the door of the restroom when you get in. Do not let them join you to bathe and do toileting. Okay, though for some, they consider this as a teachable moment to take a bath together. But at this age, try to teach them by providing them verbal cues and physical prompts. So, but don't do it with them already because you've done it when they were younger. Okay, so if it's still hard for them to follow verbal instructions, you can do hand over hand assistance, like assist their hand, but let them soap their body. So it's not you who will do it. Let them, whatever, maybe you can use a bar soap or a sponge with liquid soap on it, and then let them hold it, and then hold their hand over their hand, and teach them how to soap. So let's try to reduce your touch to their body by assisting their hand to do soaping on their body when taking a bath. Okay, if you really need to assist them, because I understand that there are many children with special needs who may not be able to follow your verbal cues, may not be able to follow your demonstrations, and then maybe physical prompting, like teaching, helping them initiate the movement is not enough. So you have to do hand over hand assistance. Okay. Always, even as young as less than 4 years old, if their arms are long enough, they use their hand to wash their private parts. So you can hold their hand and bring it down so that they are the one touching their vagina or their penis. Okay, so instead of you touching their parts when they wash. So just guide them on what to do. Just guide the motor action. So simple answers to all questions about body and bodily functions. Okay. And then some of them, you can catch them stimulating themselves. Some of them are starting to masturbate already. So you can already introduce to them the concept of, touching your own private parts can feel nice, but it's something that you do privately. So don't shame your child by doing it. You have to remember that they go through this stage, and you can just teach them where to do it, assign a place, when and where. Okay. This is the time that you teach them about body safety. Okay, your concepts can revolve around sexual abuse. Okay, is when someone touches your private parts and asks you to touch their private parts, that is considered sexual abuse. It is sexual abuse even if it is from someone you know. Sexual abuse is not your fault. Always remind them to tell about the strangers that they meet maybe online or in games. Right now, I've seen internet games, that they can actually talk to the playmates that they haven't seen. So some of the sexual offenders are there in those games, and then eventually they will chat their child and then ask for photos of them naked. So you have to be careful. So yeah, you can be open. Like if you saw them playing online games, maybe you can ask. Maybe your child will not tell you immediately. So maybe you have to be proactive and ask them. Okay. And then who to tell if someone is being inappropriate towards them. Okay, so for children with delays in language, these points can be difficult, but teaching them the rules of okay versus not okay touch, teaching them to bathe themselves, wash their private parts when they poop or when they pee, encourage them to do it mostly by themselves, they will learn not to let others touch them freely, because it's a routine already that they do it for themselves. So as an OT, there are things, these things are integrated in training of activities of daily living, or in other terms, self-care. So I have a handful of children who were history of sexual assault or abuse. Okay. They have a history of sexual assault or abuse. So I have learned that these key points to help parents identify if their child is at risk for any possible sexual assault. So it is important to at least monitor your child in play. Make it a habit to ask your children how they played. Notice any changes in their behaviors. Do not shrug off complaints about pain in their private parts as urinary tract infection. It's easy to assume that they have UTI. Okay, so one little girl I saw before, she complained of pain in her vagina, and the mom thought it was just UTI. And the girl suddenly said that her kuya, an older boy playmate, was bad and didn't want to play with him anymore. When they used to be so close, and she's very excited to see this playmate. As it turned out, the older boy inserted a toy in her vagina, hence there's pain. Okay, so, and she complained for many weeks before they actually found out. So they found out after the doctor's checkup, as there were signs of trauma in her private part. So imagine if the mom didn't assume that it's just UTI. Sometimes here in the Philippines, many parents will self-medicate, will readily give antibiotic without asking for doctor. So that's what's happened. So it took a while before they brought her to the doctor. If they immediately brought her to the doctor can have soon it should have been discovered sooner. And this is a playmate, also a boy, around 8 years old, 9 years old. So it's also a child who's doing that. Okay. So around the school age, that's around 7 to 12 years old. Usually boys play with boys, girls play with girls. They are increasingly interested in gender roles. birth, and pregnancy. So they also seek information somewhere else. So remember the boy who inserted a toy in the child's body part? So this boy actually explored the internet. Okay, so maybe he stumbled upon an adult content website. So they also seek information somewhere else, like the internet. So I have one child who used to that I used to see. He's already exploring adult sites. Okay, he has delays in language. He was diagnosed with autism, but he's actually very conversational and goes to our regular school. They start to learn bad language, inappropriate jokes, or we call it green jokes. Okay, they're interested why pets do it. So of course, for some they have pets, and then the pets will mate. So they're laughing, giggling, interested about animals' sexual activities. Okay, so be prepared. They will ask you about it. Okay. So around 9 years old, they may begin puberty. So growth of genitals, breast development, mood changes, menstruation or sperm production may begin soon. For some, possibility of masturbation. Okay, they have this like closeness of same or similar gender, identifying friendship, possibility of body exploration with others. So just like an example, I have a lot of cousins who are boys. They play with their penis as a group. So I've seen them do it around this age. Okay, so that's a teachable moment for you. Don't get angry, because it's a stage that they go through. Just deal with it in a matter of fact zone. Okay. So what to teach? Around 7, start orienting them about what to expect and how to cope with body changes that will come puberty. Okay, so that's around 9 years old, 8 years old for some. So like growth of pubic hair, so the private part might get itchy, so you might see them scratching their crotches. So you have to prepare for it, and you have to teach them to like wash their private parts instead of scratching them in public. Breast growth for girls, sometimes it's painful for girls. So I usually start around 7 or 8 as an OT, teaching them how to put on sanitary napkins and even wear sanitary napkins even if they don't have the menses yet. Okay, so especially for children who might need more support or moderate support to learn new things. It's not easy to teach them skills. So I'll start with around 7 to 8 years old. Okay. And then for children who have higher language, or maybe in a regular school, attending school with other children, other peers who are not neurodivergent, you can start teaching them about pregnancy, sexually transmitted diseases, basic contraception for children, basically not do it, okay? So you can just start introducing these concepts to them. Okay, masturbation and privacy. So even for adolescents who are not so verbal, okay, or more support, they need more support, maximum support, however you want to put it. Okay, many engage in masturbation, especially in boys. So it's more of teaching them where to do it, maybe limit to once a day, because some they would do it more than once a day. So maybe or less frequency in a week, and then teach them how to clean up after. So if you ask me, am I going to stop the behavior? Okay, first think of, is this behavior inhibiting other functions? So like because of it, they will not continue taking a bath, they will not dress up. So if it's limiting other occupations, then you should be very worried, and maybe the teacher can help you address it, a professional can help you address it, but you can't really stop it. So because it's part of who they are, it's part of natural sexual development. So it's more of teaching them where to do it, when to do it, and clean up after. Okay. So as I practice, I see many parents more open to it for boys, but not for girls. Okay. So I have a handful of girls that I saw before who would pump their private parts at the corner of the table, causing bruises and infection. So what I did in this particular girl, we changed her routine. We provided more opportunities for physical activities and exercises and taught her how to wash her vagina. She was allowed to touch herself while taking a bath, was taught how to wash herself after urinating and wash up at night. So she has more chances to, to touch her vagina. And then it's gone. Okay, she doesn't do it anymore. Okay, but there were some cases that it was more challenging to redirect, and then some of them needed medication. Now for body safety at this stage, okay, so again, I'm teaching them again about body safety. Okay, just okay, how to maintain, again, remind them of maintaining safety and personal boundaries when chatting and meeting people online, especially now that you can just make friends from people around the world online without meeting them face to face. It's acceptable now. However, you have to teach them how to dress modestly, like when they appear online, what should be their clothes. Not because you want them to always look formal, but you want to emphasize privacy. Okay. And don't just add people on your social media account. Tell mommy or daddy. Or if you have a new friend online, tell mommy and daddy about it. So the thing is, if you shame your child when you correct them, the tendency is that they might keep secrets from you and will not tell you about it. So it's nicer, or it's more helpful for your child to be more open to you, honest to you, who they meet online. If you don't shame them or you don't get angry right away, you're not that reactive. Okay. So always assure them that they can talk about it, and you will not condemn them, you will not shame them, you will not get angry. So if you are a very reactive person, very emotional, maybe you have to take a break, deep breath first before you talk to your child. Okay. And then you can also teach them how to avoid or recognize and avoid risky social situations, like teaching them, like for example, in a party or in a gathering. So avoid going to the restroom without telling the adult that you're going to the restroom, especially for homes of maybe friends. So or going to dark spaces, going to rooms of other people's home without permission. So things like that. Okay. You can actually teach them. Okay. For some, if you allow them to go on a dates, okay. Maybe at this stage you don't really expect them to date, but eventually they will date. So you can start teaching them what are the rules. Okay, and then of course, who to tell. Always when something is uncomfortable for them, always assure them that they can go to you and talk about it. Now, introducing normal development of sexual behaviors and sexual play does not mean that your worries are invalid. But there are some helpful tips for you to identify when to calm down and when to worry. So if it's sexual play, deal with it calmly and try to go through the basic information and body safety tips in the earlier slides. So remember that it is normal sexual behaviors if the behaviors occur between children who play together regularly and know each other, or occur between children of the same age, same general age, and physical size. So if your child is 4 and the other child is 8, playing doctor, reconsider, observe, or maybe not allow it. Okay, probably it's time to redirect their play, and then eventually teach your child na, okay, don't play doctor with this kuya anymore. Okay, you can play with it with younger children or children your age. So watch out and monitor. Okay, it's usually unplanned and spontaneous, infrequent. Okay, it's usually voluntary. So children agreed to the behavior. None of them seem uncomfortable. So it's easy to divert when parents tell them, no, stop, wear your clothes, and then you can explain privacy rules, it's gone. Okay, so that's just sexual play. Now, how do you know if it's a problem already? So first is clearly the behavior is beyond the child's developmental age. So as I said before, it's important that you know what usually go through, what's the progression at a certain stage. You know what's typical, what's normally seen. So if you see beyond that, okay, that's a problem. So example, a 3-year-old attempting to kiss an adult's genitals. Oh, here, I forgot. I've seen a lot of like friends or caregivers, family members, when they take care of children, sometimes they connect with the child or the baby around 3 years old, 4 years old, playing by kissing their genitals. So maybe we have to rethink that practice. Okay, there are some caregivers who would do that, and some family members who take care of young children or like 3 years old and below who does that. So if you can refrain from doing that, because that doesn't send the message of appropriate touch, okay, and what's sexually appropriate and not appropriate. As I said, you have to start early, even less than 4 years old. You have to teach them basic information about the body and body safety. So anyway, going back, in one of the seminars in the past, when I was talking about sexuality in adolescents with autism, during the open forum, one of the cases that was asked to me caused me to react negatively. The teachers told me that they have one 15-year-old boy with autism, and whenever he sees younger boys in the center, in the therapy center, it's actually a school slash sped school with therapy services there. So he would remove their pants and suck their penis, okay, forcibly. So, and this adolescent is nonverbal, needs more sensory stimulation, unable to readily imitate demonstrated motor actions. When I knew about it when I asked further, if I asked the skills of the 15-year-old boy with autism, can only follow simple one-step commands. And sometimes you have to physically prompt him to do the command. So they have to give them rewards. Okay. So what they did was, if he doesn't do it, like at the end of the session, he doesn't attempt to do it to any of the younger boys, they will give him a reward, like a food or something. So at that, and then there are times that they will call in a tall teacher that will tell him to stop. So he will stop if he sees that tall teacher, a male teacher. So he's like scared of that teacher. So if that teacher is absent on the day he's on the center, he would like go around the room and look for boys, pull their pants down, and suck their penis. Okay, so that's what he will do. So at that, the teachers didn't have a clue. I just, said straight out, that boy is abused. So that adolescent needs maximum support to learn new things. So for him to do that act, he must have experienced it many times over, and someone forced him to do it, okay, on someone else, okay? And he will do it to little boys and would never attempt to do it on another boy of the same height or taller. So after I follow up, true enough, the abuser is one of the uncles. So, and I feel sad for this boy. He's being punished for it when it's actually a loud cry that he's being abused. Okay, so don't be quick to judge on those sexual behaviors of children. So if you're a teacher or a family member, you have a relative who has special needs and behaving that way, you have to rethink, you have to reconsider. You have to think of possibilities of being sexually abused or assaulted in the past. Okay, so going back, it is sexual behavior problem when involves threatening, forced or there is aggression, involves children of widely different ages or abilities, such as 12-year-old playing doctor with a 4-year-old. Okay, so provokes strong emotional reactions at the child, such as anger and anxiety. So just like, remember the little girl that I told you about, she doesn't want to play anymore with Kuya when they used to be very close, and she's very excited to see that boy for play. Then there is excessive preoccupation with sexual words, sexual body parts, and sexual activities. So there is a repeated display of sexual body parts in public, especially when seen in school age and older children. So persistent secretive sex play with other children after being told not to. Okay, putting objects in sexual body parts, imitating and trying to have sexual intercourse with toys, pets, other children, especially in preschool or school age. So doing sexual things with much younger children or children who are emotionally or socially at much younger age. Okay, so why does it happen? Okay, since sexual behaviors are often learned, in most cases, it is a result of what the child have seen or experienced. Okay, so remember that. Something they have seen or experienced. Okay, so some children who are sexually abused may act out this way. So just like the case I've described, that was described to me in one of my seminars in the past. So other contributory factors like trouble controlling impulses, difficulty getting along with others, not being watched closely. So if those are contributing factors, you have to do opposite of that. Okay, some just arise and stop without doing anything. So like some children would touch their sexual parts because it feels good, calming, or distracting. Some of them would touch themselves without realizing it. So you tell them not to, okay? Correct them immediately. And then you can actually investigate further if the child has been sexually abused, was exposed to sexually explicit behaviors, or there are other family problems. This has to be addressed. Okay, so you have to not judge the child if they are demonstrating sexual behaviors that are problematic. You have to look further, investigate. Okay, but don't accuse, no? You don't accuse right away other people or other family members. Okay, so with the sexual behaviors that are considered as problems, these are common reactions of parents or people close to them. So first is, denying it. It did not happen. My child would not do that. Like in one of the cases I've handled, remember the boy who inserted a toy in his playmate's vagina? The parents initially would not believe it. Okay. Remember that sexual behaviors are usually discovered by accident and did not happen in front of family or caregivers. So if a child denies the behavior, be open to the possibility that, they lied to you. And please take it seriously. If the child has a problem, face it head on, seek help. Okay. Another reaction is that it's not a big deal. People may be overreacting. May be true because others are sensitive to sexual behaviors. But find out what exactly happened and prevent it from happening again. So teach your child what is expected and not expected in terms of touch and privacy. You have to review it. Okay. So if you are unsure how to deal with it, it's best to consult a professional how to deal with it. Don't shrug it off, because if not addressed, there will be consequences for your child and for other children around him or her. And then thinking about, overthinking parents. If people find out, there will be a record all his life or record with the police. So remember that the police force were trained to handle cases for younger children. So even if the offender is a young child or a child or below 18 years old. So it is possible that, always consider that when a child engaged in unusual or aggressive sexual behavior, it is possible that they were abused or something is wrong at home or in one of their environments. Okay. My child is going to become a sex offender. Don't assume readily. So some sexual misbehaviors can be stopped when the parents set up clear expectations and follow up on it, monitor on it until the behavior is changed. Now, if it persists, seek help from your doctor or professional. Now, if you are yet to see a qualified professional to help you and your child, try this. Okay, make sure that the child is supervised around other children until the problem has been addressed. Find out as much as you can about the behavior, like apply this. So some of the SPED teachers are familiar with this and some OTs are familiar with this method, like what exactly is the behavior? Identify the behavior. Is it touching private parts? Is it touching the breast? So like you have to name it. And then how often does it happen? Or does it happen every day? Or does it happen once a month? And then to whom? Okay. And then you also have to ask yourself, how has it been handled? Okay. Was there any opportunities for teaching? Was there any opportunities for correction? Was there any opportunity, or how did you react? How other people reacted to that behavior? Okay. Also, again, review and teach and emphasize the allowed behaviors versus the not allowed behaviors. And then create a family environment that does not expose to sexual behaviors, conversations, and materials. Now, before we end, I would like to summarize on what you can do to start. Okay. First is evaluate your family's respect for modesty. You and your cultural background will decide on dressing modesty. It has to be consistent. Older children should follow what you set, as the younger siblings will also follow. As a professional in this age and time when people can decide on what to wear, just emphasize on what should be covered. Especially for young children playing, we want them to be comfortable. At the same time, consider that their private parts are really covered with the choices of clothes that you buy for them or let them wear. Okay, number 2, use appropriate language. I'm overemphasizing on this. Okay, teach children their proper names for all body parts, including names such as genitals, penis, vagina, breast, buttocks. Okay. Making up names for body parts may give the idea that there is something bad about the proper name. So understand that why your child, so some children will come up with special names for it, respect that, but still teach them the proper name. Also, teach your child which parts, again, are private. Okay, always emphasize. Okay, the vagina should be covered all the time. Okay. Especially when they're wearing swimsuit. Okay. Then number 3, don't force affection. So do not force your children to give hugs or kisses to people they do not want to. It is their right to tell even grandma, grandpa that they do not want to give them a kiss or hug goodbye. Okay, so inappropriate touch, especially by trusted adults, can be very confusing to a child. So constantly reinforce the idea that their body is their own and they can protect it. It is very important that your child knows to tell you and another trusted grown-up if they have been touched. Okay, that way your child knows it is also your job to protect them. Okay. Now, I also noticed some children around 3 years old, especially girls, they would like to dress up by themselves. So even if they don't have special needs, or some of the kids that I've seen, they have special needs. They are not yet talking, but they insist on choosing their clothes and what to wear. So sometimes they would stop the parent from assisting them, like using hand gesture. Respect that, even if it takes time. Sometimes we have to be quick. School is starting, or we have to go now. So you have to like reinforce that behavior that they want to dress up by themselves. So give them the space and the time, the opportunity to do that. Okay. Next is explain what is good versus bad touches. Again, please do not forget it. Do not forget this. You can explain a good touch as a way for people to show they care for each other and help each other when appropriate or given consent, like hugging, holding hands, changing a baby diaper. So like as for us in the center, if we want to hug a child, sometimes if they're so cute, we want to hug them, but not now during pandemic. But before, we always ask them, can I hug? Can I hug? So it's like ask permission from them. So it's a like simple practice, but that will go a long way because they will not just allow a stranger to hug them. No? Okay. Even if you are a safe person because you are a teacher, a godmother, a parent, always ask permission. You have to emphasize on appropriate and with consent. Okay, consent. Give them the opportunity to agree to the touch that you're going to give them, to the affection that you're going to give them. Okay, a bad touch is a kind that you don't want, you don't like, and you want to stop right away, like hitting, kicking, touching private parts, dragging. This is common for preschoolers. Okay, reassure that your child that most touches are okay touches, but they should say no and need to tell you about any touches that are confusing or scary for them. Okay, next is give your child a solid rule. Solid rule. Don't change it no matter what the situation is about privacy, consent, and personal space. Teach them it's not okay for anyone to look at you, take your pictures, touch your body parts, private parts, take pictures of them, bathing, dressing. Sometimes parents would do that. Okay? Maybe you have to rethink about doing that. Okay. And then the rule of what should be covered, especially when they're wearing swimsuit, wearing underwear. Okay, it is easier for a child to follow a rule if you are consistent. Okay, so and then when they usually follow the rule, you are consistent with the rule, you are structured with the rule, they will kind of immediately identify what a bad touch is because they are so used to proper touch or good touch. So if somebody touched them in a bad way or it's different from the way you do it or the way you usually teach them, it's easier for them to spot it. Okay. Then very important, control media exposure. Get to know the rating systems of video games, movies, television shows, and make use of the parental controls. Okay, like it's SPG, strictly prohibited or strictly needs parental guidance, something like that. This is usually available through internet software, cable, and satellite providers. So providing appropriate alternatives like actual games is an important way or part of avoiding exposure to sexual content in the media. So be aware that children may see adult sexual contents. You can use softwares like I have here in my computer, Kaspersky. So they have this Child Protect that automatically blocks websites with adult contents. And maybe some other antivirus out there have these features also. And number 7, review this information regularly with your children. So some good times to talk to your children about personal safety are during bath time, bedtime, and before they experience a new situation. So from maybe a sports event or a dance class, you have to talk to them before they start that class, or you have a trip and then you are going to leave them in their uncle's house or another extended family's house. So you have to like review these things to them. What are the body safety information that we presented in the earlier slides. Okay, because like camps, after school programs, anything. Because during those times, they will meet many different adults and other children, so on a daily basis. So just always give them an overview of what to expect and what they should not do when meeting new people. And then lastly, expect questions. So the questions your child asks and the answers that are appropriate to give will depend on your child's age and ability to understand. So you can go back to the earlier slides and check where your child is at. Okay. If your child has special needs and needs more support in comprehension, your therapist can help you more to identify which level you can use. Okay. So the following are tips to make it easier for you. Don't laugh or giggle, even when the question is cute. Don't react with anger. Your child shouldn't be made to feel ashamed or for his curiosity. Okay, be brief. Don't go into long explanations because children, they don't like long explanations. Answer in simple terms. For example, your preschooler doesn't need to know the details of sexual intercourse when they ask about how babies are made. Okay. See if your child wants or need to know more, like having a follow-up question. Does that answer your question? Or are you happy with my answer? Okay, and then listen to your child's responses and reactions. So you have to know where they are now and where they are when you gave them maybe a short lecture or you already told them what is it, so that you can correct it right then and there. And be prepared to repeat yourself because kids would ask this over and over again. Okay. Okay. As an occupational therapist, I would like to encourage parents to include in your goal list in whatever therapy program you are at. Include in your goal setting or priorities outcomes for your child's skills are dressing, toileting, and toileting after care, as these activities are highly encouraged to be done privately. So by doing that, you are trying to reduce the risk of possible sexual assault. Work on self-management skills, helping them become more independent and can problem solve in situations. And do not forget to prepare for adolescents when they reach 7 or 8 years old. Start early, start now. Okay, if your child is 12 already and you haven't taught the basic information for preschoolers that I presented earlier, just start. It's never too late to start. Okay, always be involved in their play activities so you can notice changes in your child's play, because those are your clues when something is going wrong. And remember, especially for children with higher language skills, you are the best source of information and not the internet, not friends. So they will seek the information somewhere else. So if you don't take the initiative. So with that, I conclude my presentation and I'm ready for your questions. So you can also go to this website for more information. And here it is. We thank you for spending your morning, evening, and afternoon with us. You can visit our website to get to know more about Phoenicia, and you can support our cause. And you can also reach me if you have questions in the following contact details. That my email is there, and also the link to my LinkedIn profile. Okay, thank you for allowing us to teach you or to spend your morning with us. So let's go back to Lisa. Lisa, what do you have for us for questions? You're in mute, Lisa.
Thank you. We have currently 2 questions. How do you teach the do's and don'ts of sexuality, such as the okay or not okay to touch, personal boundaries, And then the next one is around toilet cleaning up to individuals with severe intellectual disabilities. I have a 16-year-old patient who does not know how to clean herself, and her parents' caregivers does it for her. So I see that as two different questions, and I think you covered kind of the how do you teach the do's and don'ts of sexuality in the upfront of and throughout the presentation, and what's okay, what's not okay from a touch perspective. But I think the concern here more is around the 16-year-old girl who has a severe intellectual disability and still can't clean herself.
Okay, so I usually we're successful, but I used to see a girl before that, you know, they need more support, they need a lot of assistance. With this, I always tell the caregivers and the parents to use the hand of the adolescent, like the girl, use the hand when to clean themselves. So I understand that it's the adult who's doing it for them because the child has difficulty learning, the adolescent has difficulty learning the washing, and maybe they're worried that some germs are still there. So just use the hand of the girl to touch her private parts. I understand that you may never be successful in terms of teaching them how to wash themselves, but you can apply these principles by not touching their body part, by not touching their private part. You just use their hand, hold them, like do a hand over hand assistance. So example, this is the child's hand, the adolescent's hand. Hold it for them or hold it on the wrist, and then wash themselves using their hand. So you just bring it down for them to wash. So in that way, with continuous practice, some of them will attempt to actually clean themselves when you like turn on the faucet or turn on the shower head when you're about to help them clean up. Now for the appropriate touch and inappropriate touch. So usually what I've experienced in young children, maybe not so young, adolescents or even adults who have low language skills, they like grab you. So usually we correct them by demonstrating, touching their hand. I don't like grabbing. Gentle hands. Please, this is how you do gentle hands. I will hold their hand and do gentle hands. Avoid grabbing. And then I also teach them where to touch. So if some of them will grab your hair, I've experienced that. If they're trying to call your attention, they will grab your hair, they will touch you anywhere. So even if they have low intellectual disabilities, you can provide them hand over hand assistance to demonstrate, make them feel what is gentle touch and where to touch. Be patient with the adolescent, and then eventually they will get it. So I may not be successful in teaching an adolescent who has a severe mental disability to independently wash themselves, but at least they can assist in the cleaning by just, touching their private part and not hurt you or grab you anywhere else, but just your hand and use gentle touch. So I think that's the only success that we have in terms of sexuality. And that's already a big step for them. So any more questions? I hope that answers the question.
So here's another question is, when is the best time for parents to actually introduce sex education to a child? How will the parents answer the question of the child's origin? So I know you were saying earlier within the presentation, some kids it's too early. But I think this parent is actually asking when it is the right time to introduce it. And how would you handle the child-parent discussion on that?
Okay, we'll start with around 4 years old. Okay, start with 4 years old. We'll start with topics such as body parts, what is it for, labeling of body parts, and then of course I will not talk about how babies are made. So it depends on what the child is asking. So can you like tell me, or so wait now. So you may want to initiate. So just start with body parts. What is it for? And how to cover body parts. And then emphasize on what to do privately and what to do, what you cannot do in public, like where to change your clothes, where to undress, and then how to take a bath, when to take a bath, and to whom are with you when you take a bath. So those things, will start with that at around 4 years old.
No, but I think the question that they're really asking, Van, is more about what age and when is it appropriate to actually talk about intercourse.
Oh, okay.
Right? That's really the question. That's how I'm reading this here. I think is really what the parent is asking, and if I'm reading this right. So
okay.
we get from like, right. So, you know, when is it developmentally or age appropriate to actually start to have that conversation is how I'm reading.
School age around 12 years old, 13 years old, because some of the children have their menses at that time. Some girls will have their menarche around 9 years old, 10 years old. So the possibility of getting pregnant is around 13, 14 for some. Here in the Philippines, you have those kinds of pregnancy. Around 12, early. Like, don't wait for others to introduce it to them, because the content, that sexual content, will come in maybe earlier. Some of the children, like I have one child that I'm seeing, well, I used to see, he was introduced to adult content around 8 years old by classmates, like they're like online, everything's online, it's a shared link. So he was exposed to it. So even if the plan was to introduce the concept of sexual intercourse around 10 years old and 11 years old with the mom, so they have to talk to him earlier. So I think the safe answer for it is around 12. But if you are consistently monitoring your child and they are so exposed in the internet and you don't have any software that will block the adult contents, maybe you can start earlier, around 10, 9.
The next question is, what is the appropriate way to respond to a teenager with ADHD who has expressed that he has a crush on you? I have a client who, he has been a client for a while and has been asking about my current relationship status.
Oh, okay. He has ADHD. Maybe you can start. Okay, I understand that the nature of like work of therapists and teachers are very personal. So the child shares to you a lot, especially for children with ADHD. They tell you how they feel, that you kind of process with them their emotional situations, or how they process their emotion. So we can start. Usually, I haven't really experienced that, but I set boundaries in terms of what the child can ask me. So like there are some kids that would ask me, "Are you married, Teacher Van? Do you have something like that?" So you can actually answer it, "Yes, I am married." But now next time, that's not our topic. Can we not talk about those things? Okay. And then for the crush, if they communicate that they have a crush on you, you can acknowledge that and say, I am flattered that you find me attractive, maybe attractive because you said I am your crush, but I think it's more appropriate for you to have that admiration to other girls your age, something like that. So you kind of redirect it. And then if you can say, if it really makes you uncomfortable, you can actually be honest with the child. So I don't want to hurt your feelings, but I'm not comfortable if you keep on telling me that I am your crush. So I already know about it, and I acknowledge that you like how I maybe look or how I talk to you. But again, I already told you that you can have that admiration to other girls your age. So you can redirect it to a more appropriate age group. So that's how will I handle it if I get that. But I experience children, especially with ADHD, asking me a lot of personal questions. Even they ask me about how to make babies and all these things. So I hope that answers your question.
So this goes back to the prior question. I think it says, is it not too late to discuss labeling of body parts at 4? Why not 2 when the kids are beginning to explore themselves together with their peers? This is also where play begins. I think that's what you had said at the beginning of this presentation, that start as early as possible. But I think you were referring back to like a little bit more mature level around exploring more around the sexuality of the touch and other things. Is that correct?
Yes. The body parts and what is it for, you start as early as you can, as long as the child can already imitate, can point, can comprehend. Some of them may not be able to repeat the words, but they can actually, where is your tummy? Where is your hands? Then they can point, they can raise it. So you start early. And it's usually the first concepts that you teach your children are not letters, not colors, it's the body parts. So please maximize that years in teaching them how the body parts are called.
The next question is, if one of my students were sexually abused and are showing violent behaviors towards others because of the trauma, how will I address this as a teacher? What are the proper steps to follow to help the child?
Okay. First, I'd like to call in a family conference for that. So maybe we can inquire to the family how they are handling the post-traumatic experience and how they have been facilitating that hopefully post-traumatic growth after that incident. And then you as a teacher, what would I do if I were in your situation and I know the history of the child, the sexual assault history of the child? If it's possible for you to make time for the child, maybe this child wants to talk about his emotions and wants to externalize it through verbal communication, because it's most likely that this child is trying to externalize or trying to communicate his negative feelings through hurting others and acting up. So this child needs help. So first, I'd like to call for a family conference and inquire what they have been doing. And then if there's none, they're not doing anything, maybe I can recommend that this child should go to like a therapy, a different, maybe see a child psychologist. Just be careful with your words, how you tell the family about it, because for one, they might be already, feeling bad about what happened to the child. And then they might not be able to realize that the child needs help. So as a teacher, it's your duty to at least communicate to the parents that they have to do something more than that. They have to seek help, external help from you. And then as for you as a teacher, if the child allows it, if the child gave you the consent that you can have a one-on-one session and maybe talk to you how he feels, don't force it. Just assure him that you are available to talk, and you are a safe person to talk, and you are hoping that he can at least reduce those negative behaviors that he's showing to other children. So that's what you can do. Do you have any ideas?
No, I had a question around that, because I wonder about families who may not have the medical or the support to see a psychologist. And I'm just wondering, particularly if this is somebody who's asking from the Philippines, if there is any social services or other government support or psychologists that parents can actually get to. Just because I know that, means are sometimes really difficult, right, for certain families. And those who are in remote places. So how would the parents or the teacher, how would the teachers or parents deal with that? Is there social workers or others that can support such a thing?
Okay. Usually public schools have this guidance counselor. So they hire guidance counselor. So you can actually inquire if the guidance counselor can can assist you. But most schools have this guidance counselors. So you can refer that. But if not, maybe that time with you can help. Okay, can help your time with you, talking to you, and asking the child how they're feeling, how they're going through, how they are coping. So just give them time so that they can externalize, at least they can communicate to you how they feel. So I think that's the best option for us, given the limited access to these professionals here in the Philippines.
We have one last question. I answered that one, sorry. How can SPED teachers teach effectively about sexuality through online class?
Sorry?
How can SPED teachers teach effectively about sexuality through online class? I guess because you guys so many are online, right, the teaching. So how do you actually teach effectively about sexuality through online classes?
Okay. First, just cover the basic information that was presented to you, like body parts, how they use it, and then privacy, consent, and privacy and consent through like pictures. Like you can use pictures. You don't have to use like explicit pictures. The picture that I presented in the earlier slides is just, just cartoon pictures with marks on it. So you can already teach appropriate and not appropriate. And then before the presentation itself, you can actually, if the parents are available, you can have a prior session to them. Like for example, if you present a picture, it is important that you do at least a role play. Like for example, you presented touching breast and it's a no-no. Like in the picture that I earlier presented, there's a breast and then a touching hand and then there's an X. So when you present that, someone has to like touch the breast and then stop the child. So the child, well, you can demonstrate like touch breast and then stop the child, just to communicate to him that, okay, this behavior is not expected. This is a no, you shouldn't do this. And provide that hand over hand assistance or physical restraint to stop the child from touching someone's breast. So it could be a combination of pictures presented, of expected and unexpected behavior, and a little bit of role playing. So you can do that, but it's kind of hard if the other person assisting the child with special needs at the other end of the video conference will not get your instructions. So it's better to have a session prior to that presentation with the child, so that you can actually rehearse it with the family. If that's possible. So because I know right now not all schools, even SPED school, can go everything online, like a synchronous session. So some of the teaching are done offline, like you just send materials to the parents and then the parents can do it. So you can actually, if your setup is offline or asynchronous, you can prepare materials like more of pictures and maybe prepare a video presentation that you can send to the family. So I hope that helps.
Yeah, and then I was just going to say that one of the comments that we received back from one of the around the question that I actually had around making sure that if a teacher was trying to support somebody that actually was either sexually abused and had trauma around it, and or a teacher suspects, right? This particular panelist indicated there is a mechanism in the schools to handle such issues and can further be evaluated to the social services before they are endorsed to law enforcement. And that's very, very similar here in the US. There isn't zero tolerance to any type of expectation, but it is, escalated and brought to the right, authorities and or parents and social services. So thank you for that panelist for that comment. And so with that, we are going to wrap. And I just want to thank you, Van. I know we are getting many comments from folks saying what an amazing topic, and it is a topic that's not easy to discuss. But I'm glad that we were able to actually do this, and we want to be able to continue to have more conversations around this. And if anybody does have any particular questions, feel free again to reach out directly to us, and we'll make sure that Van is able to answer them directly for you. So thank you, everyone. Continue to follow us on Facebook, Instagram, and YouTube. We will continue to be supporting you with more webinars, and let us know if there are topics that you want to make sure that we are addressing, and or a hot topic that you want to make sure that we're covering. I would greatly appreciate you letting us know. And clearly it's time to wrap. Nathan is probably hungry and ready to go. So I hear him in the background. He's pacing, he's ready to eat. So, all right, thanks everyone. Have a great afternoon, morning, and evening, wherever you are. Take care, bye-bye.